Why is snap-in dentures not the best solution? Hi, I'm Erica.
I'm Dr. K with Summit Point Dental Implant Center.
Today we are going to be talking about snap-in dentures, also called overdenture or denture stabilization.
So some of you watching, either yourself or you know someone that has a denture or even got a snap-in denture recently or been in it a while, I just want to go and give you kind of a demonstration of what it is. Okay, so this is a patient, for example, a model of a patient who's had a denture. This is the suction for the top. This is how it's held in. Some patients even have to use adhesive to hold it in. So it's not the best thing. It's just a piece of plastic basically in your mouth with teeth on it, okay? What denture stabilization or snap-in dentures, what it is you've got a prosthetic made for you and you've had either 2 to 4 implants placed, and you're basically trying to stabilize your denture pretty much over onto the implants. If you look over here, these are the implant heads. We call them locators. They pop in, you hear a snap, and that's how they're held in. Now it sounds great on here, it looks great, but from our experience with patients who've had this done, they're usually not as happy with it as if they had something fixed, because it does tend to move around when they're eating or chewing or just talking. Food trapped underneath it pretty easily. And for example, a patient who has dentures, when they bite into food, they're only getting about 20% of the natural bite force for compared to somebody that has all their natural teeth. With a denture stabilization, you're probably getting about 40, maybe 50% of that bite force. With the fixed option, if you ever decide you want to get the best option, which is what we recommend, is having 4 to 5 to 6 implants placed and having everything basically screwed in into this, kind of similar to this. You're able to achieve almost 100% of your natural bite force once everything is fully integrated.
From most of our patients, we hear most of the complaints are that they're not able to eat their foods regularly. Even with snap-in dentures, that movement is going to be, you have to learn to chew on both sides. If you try to chew on one side at a time, which is what most people do because they have a more dominant side, a lot of times they're still going to rock back and forth in their mouth, creating a crevice where the food can get underneath, which can also be bothering you while you're trying to eat. So imagine if you're out at a function or with friends or family and y'all go out to dinner and you have these snap-in dentures. These are just some of the things that you're going to want to consider before getting this done. These are some of the risks and the things that are going to make you uncomfortable. So we just want to make sure that we give you as much information as we can to make the best decision for yourself. We also know that finances are an issue sometimes, and the good thing about going into a snap-in is if you have a plan to maybe start there and then upgrade later, which is what we recommend, to get you into that fixed sooner rather than later, of course, just because we want to preserve the bone, then you can have a quality meeting with your doctor so they can make sure to place the implants at the right depth to where we can use those implants later to convert you to the fixed option.
Yes, and you may have had your dentist tell you, about dentures, like once you have your teeth removed, you do lose bone over a period of time. Some people lose bone faster than others. The same thing is true with overdentures. We have noticed patients who have had overdentures, just because the bite force is not as great, you don't lose bone as much as you would in a denture, but we typically do see patients losing bone, especially in areas where there is no implant around that area. So over a period of time, usually several years, you will notice more rocking of your overdenture than as if you had it placed initially. So that's another reason that we recommend to have like an implant bridge. The procedures are called all-on-X or all-on-4 procedure, because the bite force is very similar to your natural teeth. Every time you bite and chew, your body still thinks your teeth are still there, so it preserves the bone. Your body basically, the phrase use it or lose it, it does apply to implants as well.
So a lot of times, I know once we go home, sometimes people need time to process this, and they're like, one of the main questions is like, what if I don't listen? What if I don't do what the doctor recommends me to do? Some of the things that you're going to run into are going to be, basically it's just your quality of life. Like I said, you're not going to be, we see a lot of patients that come into our office that have already had their teeth extracted. They're already in a snap-in and they're still not happy. So we end up trying to help them. So your quality of life will just not be the same. Like Dr. K said, you're going to get more bone loss. And in the long run, what you want to consider the most is you've already paid for one surgery. You've already paid to have the teeth extracted, to have some implants placed. But depending on that doctor and what the future plan is, like I said, you could be paying double the amount of money and spending higher costs later just by having to have the surgery redone. If we can't use those implants, and if they weren't placed at the right depth, then a lot of times we have to place new implants, possibly remove those ones, just to be able to get you into something fixed. So these are all things that you're going to want to consider.
Yeah. So at our office, we've helped thousands of patients achieve their most beautiful smile in the most effective ways.
If you are not happy with your current situation, and let's just say you're on the verge of losing your teeth and you need to make a decision, or if you're already in a denture or even a snap-in denture, don't give up hope. We can help you here at the office. So just give us a call at 469-625-0005 or click the link below and we can schedule you an appointment for a free consultation. Thanks a lot, y'all. Thanks for listening.